And thank you for joining us. With us is Kylee Hauser, Mammotech with Meadville Medical Center.
Yes.
How are you?
Good, how are you?
Good. Well, actually, technician, we should say, right?
No, it's actually technologist.
Oh, technologist.
Yes.
Perfect. See, let's learn about what that position entails and what you do at Meadville Medical Center.
All right. Well, like you said, I'm the Mammotech at Meadville Medical Center. Been here about a year and a half. So you start off by going to x-ray school and getting your basic radiology x-ray degree, and then you kind of branch off from there. So then mammography is a separate registry off from that.
What age did you know this was the direction you wanted to go?
Probably more in like my mid-20s. Took me till about 30 to get there. So I was able to cross-train at my previous job, and then kept watching for a full-time mammo position to open up and led me here.
Where'd you grow up?
I am actually from Ohio. I grew up in Ashtabula and still live in Ashtabula County, just in Andover, just over the line.
Okay, so this opportunity came up and you thought, I think I could do this.
Yes.
The training that kind of went into this, talk a little bit about that, and we want folks to know who might have an interest in getting into this field, what it takes to do it. It
is like I said, a separate registry, and it starts off by you kind of log on to our main registry site on ARRT, and it will give you the guidelines on what exactly all you need to become a mammotech. It was 100 mammos checked by another registered mammography tech. Your first 25 have to be with another registered mammography tech. And they can be all screening mammograms, some of them, and then you have to go off and branch off into other specialties, like you have to do so many diagnostics and so many procedures, and then you have to take a 40-hour course. A lot of people do the MTMI course. It's like a week-long course where they sit and they go through all the different aspects to help you get through your registry. And you have to have 16 hours of digital tomo training, which is the 3D imaging that we do. So you have to have 16 hours of part of that, that 40 hours has to be the 16 in the tomo training.
We're going to talk about the technology involved because it's pretty incredible and it's doing amazing things. But we should also let people know that this part of Meadville Medical Center is located where?
We are located at Vernon Place, up on top of the hill, on the second floor.
Talk about just having that part of Meadville Medical Center, because that's a fantastic facility.
Oh, it's beautiful up there, and it's very nice. Our women's center, we're kind of secluded from the rest of the radiology department, so it's just women back there. We really try to seclude. We do have some gentlemen that come in for mammograms, and when that happens, we try to make sure that none of the other women are back there in their gowns prior to bringing the gentleman back, and then we bring them back out. So we try to keep everything very private and secure for the women, because it's a very nerve-wracking time for them. And it's nice because we're in our own little corner back there, and we have an ultrasound room dedicated just for breasts right in that corner. We have 2 mammography units in that area, and then we do actually have a separate procedure room for where we do stereotactic biopsies, and then also we do ultrasound guided biopsies up there as well.
So a lot of people would know October is Breast Cancer Awareness Month, but you should be thinking about this year-round. You should be making sure that you're hitting all the checkups you're supposed to be hitting. So let's talk a little bit about that, because it's hard to believe, 4 years ago we were in this pandemic and a lot of things changed in terms of the routine care that people were receiving. And somebody may be at home thinking, oh yeah, I've been meaning to get back and see my doctor and get back to these checkups, but it is extremely important. And maybe kind of just talk a little bit about that aspect of it and why you should get back to that routine care.
Yeah, so it seems to be getting a little bit more back to normal here. A year or so ago, we were still seeing people who were last done in 2020. So people are finally starting to come back and get back into normal routine. And we did kind of lose a lot, so we jam up more in different areas of the year because of when the pandemic hit, and so people's yearlies might have delayed out a little bit. But as long as you're coming in and you're getting that care, get back into routine, that's the most important part. We do require a doctor's order for mammograms here at Meadville Medical Center, and so if you have to get a hold of your primary care and get that order, and we're pretty quick about getting you scheduled in for a regular screening mammogram. Usually less than 2 weeks we can get you in there for an appointment, and we try to be very flexible with the patients as well.
Talk about the imaging and the quality and just the technology involved. It's pretty amazing.
Yes, we do offer the 3D tomosynthesis imaging at Meadville Medical Center, which is the latest and greatest, and it is just standard care. That's what we do on everybody, and it allows us to take more detailed images of the breast. We don't have to women will come in and be like, oh my gosh, that's not as bad as it used to be. It used to really hurt. It used to really smash you down. Well, we've gotten new paddles and stuff that you kind of flex with the patient's breasts a little bit more, so it's trying to make it more comfortable as possible.
And believe it or not, that was an issue for some hesitation to go see their doctor and have these tests, right?
Oh, yes.
Because it was uncomfortable.
And so with the 3D imaging too, we just have to make sure that the breast is nice and tight and taut in that area, but we're not just cramming you down in there as tight as we possibly can, because the 3D images takes a lot of pictures as it comes across, and then lets us see slices through the breast tissue.
The other thing that amazes me with this is there's an opportunity, if there is maybe something that's showing up that you are starting to question or say, this might be a concern. It's not necessarily, hey, see us in a year, let's see what happens. But with the quality of the imaging, you might be asked to come back in 3 months as opposed to maybe 6 months or a year. There's maybe a better opportunity to catch something earlier on with this technology.
Yes, absolutely. It is definitely more sensitive. And then we work very closely with our radiologists here. And they're very good about us calling and saying, hey, we just did this screening and I really don't like the way this spot looks. Would you take a look at it real quick, and maybe I can call and get an order for diagnostic or something while the patient's here, and try to prevent them from, try to keep it while they're there as best as we can. And sometimes we don't always aren't able to do that, but if we really see a spot, they're like, man, we just really don't like that area. A lot of times if the radiologist is there, we can walk into the office and be like, hey, will you take a look at this? And they're great to work with, and they're all about getting the best patient care as well as we are. So
a lot of times the discovery of symptoms takes place at home, right? So what are some things what's that checklist that you should be doing at home?
Well, we actually have
perfect.
a little flyer here. We keep these right in the breast department. So patients can pick them up and take them home, and it kind of explains to you how to do your self-check and when you should be doing it. You should be doing it once a month. And then on the back here, it also even you want to hang it on your fridge or keep it in your bathroom or on your nightstand or something, and it'll let you check off that you did it each month. And so any changes at all, any breast tenderness, if you have a pinpointed area of breast tenderness or redness and swelling, you notice any kind of skin dimpling, thickening of the skin area, obviously any kind of lumps, bumps, those are all areas of concern. You should be giving your doctor a call.
And then from there, they'll refer the patient to your department.
Yep. Most of the time then, a lot of times the doctor's offices will have them come in. Some doctor's offices may automatically, if they're a regular patient of theirs, may put the order in right away so that they can call and get scheduled and get put on to come in for a diagnostic mammogram, which is a little different than a screening mammogram.
And now these can be found in your office?
Mm-hmm.
Okay. And these are fantastic. You can grab these, and again, that's a good place to start. And then if you, as you say, if something does appear, get a hold of your doctor and start that process. Better to be safe than sorry.
Always better to be safe than sorry.
Yeah. Let's talk about bone density screenings.
Sure.
What's involved with that?
So those are every 2 years, and patients come in, and it's way simpler than the mammograms. It's kind of like an x-ray table. They lay on the x-ray table and get a real light, low dose x-ray of their lower back, lumbar area, and their left hip. And in some cases, they'll do like a forearm or a wrist as well, depending on what their patient history is.
And so those are every 2 years?
Every 2 years, yeah.
Okay. And is this part of just a routine checkup, or somebody's coming to see you, maybe kind of give the reasons why?
Most of the time it's just a routine screening checkup, especially, a lot of ladies will correlate these with their mammograms and come in because it's all in the same little area.
Okay.
A lot of times oncology patients will come in and see us because of different treatments. They might be worried about their bones thinning and getting osteoporosis at an earlier age. So, but most of it's just all preventative screening care.
And again, a number of reasons to have those, but go see your doctor, have that conversation, and then start the process of getting to your department.
Yep.
We'll talk about your department and the Yolanda G. Barco Oncology Institute, and just the way cancer is being identified, treated, the whole process here within Meadville Medical Center, because it's truly amazing.
Yeah, so we work very closely. There's breast navigators over at the Yolanda Barco Center, and we talk to them sometimes on a daily basis, and they're great. We can call them anytime. Actually, I have the one girl's phone number right in my phone, and we'll call each other, hey, when you get a chance, I need you to look into, and they're making sure that they're also helping us not miss a step, or somebody to get lost in the gaps or the gray areas of, okay, the patient came in for the screening, okay, now patients come back in because there was an area that they wanted us to take a closer look at. Maybe now they want to do a biopsy on an area. The navigators and us make sure that somebody doesn't get lost in the results going back to the doctor's offices and getting those new orders and getting them back in for those procedures. And then they also help us track the pathology and getting them into the cancer center as quickly as possible.
I'm sure you've heard story after story from patients who have just fallen in love with the care they're receiving here. How does that not impact your life? I mean, that's pretty amazing.
Yeah, we actually have a lot of patients. They'll come in, and those, we don't go very far. We're always the same faces that they see every year. There's a couple techs there that have been there for many, many years, and so we're always going, well, you're new, you're not Kim, or you're not so-and-so. So, or you get patients that just grab you up and give you a hug at the end, and they're happy to get good news, or when we hate having to give the bad news that we have to maybe proceed on with a procedure, but we were there to help comfort them and answer questions, and when we see them the next year and they're doing great, we love to see that. So, we get very close with our patients. And
attitude plays a big role, right? So if there is that conversation that is a little heavier than, hey, you look good, come back in a year. There's so much that has changed over the years in treatment and options that are available that having a good attitude can be very helpful.
Yes, on the patient's end, and also, from the people they're receiving their care from, help keep them in good spirits.
We mentioned October is Breast Cancer Awareness Month. However, this is something that you should be thinking about year-round, just at least checking. If there are concerns that come up during the year, call your doctor. We've mentioned that several times. But again, it's very, very important. What hobbies do you have outside of work? What do you do to relax?
I live on 250 acres of a family farm.
Wow.
20 acres of that is ours, but we're all connected. And we do maple syrup in the spring, and just kind of little hobby things. We have trails in the backwoods that we ride four-wheelers and stuff on, but mostly just family.
So getting out and enjoying
Oh,
life.
yes. Oh, I'm an avid golfer.
Oh.
Not a very good one, but I like to go golfing.
That's been a big theme. A lot of people like to get out and golf, but they always say, not very good at it.
No. That's one of those things that very few master, I feel like.
Yeah. working here, living in this area, sounds like it's sort of the perfect fit for you. Talk about the pride in working at Meadville Medical Center. And again, we mentioned the patients and just the support that they have, but that has to make you feel good at the end of the day, knowing that you get to help the people here.
It does, and the people that I work with, other girls that I work with, are wonderful. We have such a great team and a great group of girls up there in the breast center that make coming to work enjoyable every day. So that is a huge, blessing when you're working somewhere.
Before we wrap up, just give us a couple quick tips for those watching, things that they should be thinking about year-round.
Monthly checks is a big thing. Coming in for your annual screening is also a very important area of coming in. So the more you come in, making sure that you come in yearly, we have more for comparisons to go back to through the year. So if something looks a little bit different, or a doctor is questioning maybe this area, if we can go back through your prior images, comparisons is a very important part in the mammogram world. If somebody is moving in from out of state or moving out of state, try to get your breast imaging before you move to bring with you. That way when we have them to upload, it'll allow us to get your results to you faster.
And I think that comparison part is extremely important, because
Yes.
there is that history that you can go back and say, boy, you know what?
This wasn't here before,
Yeah.
we better look into this. So
Yeah.
that's, comparisons are very important when it comes to mammograms.
Kylee, very informative. Thank you.
Thank you.
This was fantastic. We hope you learned something as well. And of course, if you have any questions, contact your physician and get that conversation going. We appreciate the conversation with you. Thank you.
Thank you.
And thank you for joining us as well.